Sanchez, and I'll be performing the NG tube insertion video. So first, you're going to make sure that the physician's orders are correct and that it is the right patient that you're going to be doing this procedure to. Then you'll gather your equipment, which is the NG tube, the tape, and some type of marker to mark after you're done measuring how far the tube's going to go in the back of their throat to their stomach. And then you'll go into the room, you'll perform hand hygiene, and if there's a curtain, you'll pull the curtain to provide privacy. If not, just close the door to make sure nobody else is going to come in while doing this procedure. And then you'll identify yourself. Hi, my name is Lydia Sanchez, and I'll be your nurse for today. We're going to be performing an NG2 procedure on you. But first, I have to make sure that you're the right patient, so I'm going to ask for your name and date of birth.
Pedro Paredes, 03/15/1994.
Okay. Have you ever heard of an NG tube being inserted or
No.
having one in? No? Okay. So which nostril do you breathe better out through?
The left.
That one? Okay. Can you tilt your head back? Okay. And once you make sure all that is good, then you'll ask them to swallow for you. So you take a little bit of the water. Okay. And once you can see that they can do the swallowing action, then you can proceed forward. If the patient has any trouble swallowing or has had a stroke, you want them to just swallow with no water, just swallow to perform the action, and then you can move forward. After that, after you have seen that happen, then you'll put on gloves and you'll get your NG tube and you'll measure from the nose to the ear, from the tip of the nose to the ear, and then you'll hold that in place, and then you'll measure from the ear to the xiphoid process. And after that, you'll place it back down, and you'll mark it where the xiphoid process is at. You'll give them the cup again, and then you'll tell them to tilt their head a little bit down, their chin down. Tilt your head. There you go. And then you'll start inserting, and you'll tell them to start drinking the water to make the swallowing motion to make this easier. So it'll go down their nose, down their throat. Keep swallowing. And tell them to keep swallowing until it's all the way down, so keep swallowing. Okay, once it's where the marker is at, then you'll stop. And in order to make sure that it's in the right place, you'll make sure that there's no air coming out. That means that it's not in their lungs and it is in their stomach where we want it to go. And then after that, to make sure that it actually is positioned in the right place and it's all the way in the stomach, you'll send them off to get x-rayed. And after that, when they are ready to remove the NG tube, so you'll basically just tell the person to take a deep breath and you'll slowly remove it. Okay, and then you'll hold it. And after that, you're basically done with the insertion and removal of the NG tube. You'll discard the NG tube and you'll take off your gloves.